Okay, good afternoon, everybody. Thank you so much for joining. We're going to go ahead and get started just to be mindful of time. If we want to advance to the next slide, we will throw up the introduction slide. Please feel free to introduce yourself in the chat with your name, organization, position, and favorite part of winter, if you enjoy winter at all. And we can go ahead and go to the next slide. Dr. Rupa Thakur, faculty of this educational activity, has no relevant relationships with financial companies. No relevant financial relationships with ineligible companies to disclose. Dr. Thakur is a practicing pediatrician at Cleveland Clinic Children's. She's board certified in general pediatrics and earned her medical degree from The Ohio State University College of Medicine in Columbus, Ohio, and completed her postgraduate training at Cleveland Clinic Children's in Cleveland, Ohio. Dr. Thakur's interests include resident education and healthcare advocacy. She currently serves as an associate program director of Cleveland Clinic Children's Pediatric Residency Program, overseeing the primary care experiences of Cleveland Clinic's pediatric trainees. A lifelong resident of Ohio, she's committed to improving living conditions for our community's children and serves as the medical director of school-based healthcare, the medical director of youth strategies for Cleveland Clinic Community Health and Partnerships, and medical director of the Ohio chapter of the American Academy of Pediatrics Lead-Free Ohio program. With that, I will pass it over to Dr. Thakur. Thank you.
Thank you for that lovely introduction. So I'm here today to provide a brief refresher on lead poisoning prevention. After today's session, we will be able to identify the impact of lead poisoning in the developing child, describe some updates to the Ohio Department of Health's guidelines for the medical management of elevated blood lead levels, and discuss the Ohio AAP's upcoming training program. So why are we even here? Why are we talking about lead? We know that lead is a ubiquitous neurotoxic metal that deposits from the blood into every tissue in the body and impairs basic cell functions that are common to all tissue types. So that's really why we see lifelong consequences of childhood lead poisoning at even very low levels of exposure. At even lead levels under 5, we might see delayed puberty and kidney function, decreased academic achievement, lower IQ scores, as well as attention deficit and antisocial behaviors. And at lead levels up to 10, we might also see reduced postnatal growth, hearing impairment, and even increased risks of asthma and eczema. Now, the vast majority of cases of lead poisoning are acutely asymptomatic. So that means that they don't show any signs at the time of being lead poisoned. And this is why we screen based on risk of exposure rather than symptoms. If they do have symptoms, they could be irritability, behavioral problems, abdominal pain, lethargy, loss of appetite, headaches, memory loss, and in the event of a very high lead level, could even have seizures. But that list is pretty vague. They're very vague symptoms. And unless you're thinking about lead day in and day out, like I do, or like Dr. Newman does, you may not immediately recognize that these symptoms are potential lead toxicity. So definitely screening is the way to go in terms of identifying this in our children. And then we know that lifelong consequences can include decreased bone and muscle growth, hearing loss, damage to the nervous system, ADHD, developmental delays, and decreased IQ, as I mentioned a moment ago. There is data to suggest that up to 25% of ADHD cases could be attributed to lead exposure, and that antisocial and criminal behaviors may be linked to lead exposure as well. Academic performance suffers proportionally to lead level. This data was shared by Detroit Public Schools. Shown here are the predicted probability of failure of the Michigan Education Assessment Program's tests in math, science, and reading as a function of the blood lead level. And I think things should show up here. Yep. So marked here, you can see the current CDC reference standard of 3.5 in blue and the state's current threshold level for home inspection in red. And if we look at math in particular, and if I hit next again, there we go, you can see that the probability of failure with a blood lead level of 3.5 is about 30%. And you can see that the probability of failure with a blood lead level of 10 is just shy of 50%. So that's a huge difference in academic outcomes and really reflects an opportunity for our system to improve in terms of interventions available for lead levels 3.5 to 10. In addition, this demonstrates the ultimate take-home message, which is that primary prevention is critical to our children's success. Our goal is that no child is exposed to lead because we know that there is no safe level of lead in the body, and because the effects of lead poisoning are not reversible. Therefore, we need to recognize common sources of lead contamination in our environment and implement preventive strategies to prevent exposure. Preventive strategies include reducing hazards by eliminating the source of lead contamination itself, by ensuring lead-safe housing, and if you're renovating, ensuring that lead dust is properly contained and disposed of using lead-safe practices. Since we can't completely eliminate lead in our environment, we also need to take measures to reduce lead exposures using good cleaning and hygiene practices. And finally, we can reduce the body's absorption of lead by encouraging a good diet with adequate iron intake. As we're preparing to have these conversations with our patients, by thinking about the populations that we serve or thinking about the specific child's living environment, it's really critical then to understand those common sources of lead and learn some of those preventive strategies to share with them. So the most common source of lead, as we know, is lead-based paint. There we go. 80% of Ohio's lead exposure comes from lead-based paint, but 20% comes from one or a combination of other sources. Lead contamination can also occur through occupational exposure. It can be present in our soil, our foods and herbs and spices that we use for cooking. Toys may be painted with lead paint, especially some heirloom items that might be in the family and passed on to children. There are a number of traditional cosmetics, medicines, or ceremonial powders that contain lead as either a main ingredient or a contaminant. Water contamination can reflect either sporadic failures of corrosion control, like in Flint, Michigan, or low-level constant leaching of lead from pipes over time. And because we're drinking water all the time, or we should be, you multiply the small amount of leaching to the large amount of water that we take in, and you can see that the total exposure can then be quite large. And when thinking about water contamination, it's important to note that the municipal water lines or service lines in the state of Ohio are generally safe. It's the lines from the service lines to the home that were made from lead in the past. Lead pipes were banned nationally in 1986. There are some cities or counties that may have banned them even earlier. And then lead plumbing and fixtures were allowed until 2014. So there is still that risk because that's a pretty recent change in codes. So there still is a risk that there are homes that have those fixtures in place. There we go. So we know that 80% of kids are exposed by lead in housing, as we mentioned before, and that 2/3 of Ohio's housing was built during the lead paint era before 1978. This represents much of our inner city as well as rural housing stock throughout the state. The highest amount of lead can be found in homes built prior to 1950 and is found in the lead-contaminated dust from deteriorating paint that coated the doors, windows, trim, and porches primarily. And when we look at lead-based paint in homes, it's of course not just the age of the house, but also the condition of the housing and neighborhood maintenance that factors into the degree of lead exposure. So if it's an older home that's been regularly repainted and wet mopped, the exposure risk will be much lower than a home built in the same year, but with chipping paint and dust accumulation in areas where kids are playing. From the outside of the home, parents can bring lead particles in from work or from their hobbies. High-risk occupations include construction and renovation, those who work with lead batteries or lead recycling, welders, plumbers, and firing ranges. If there's a family member with an occupational lead exposure, and if they have facilities at work that they have access to, we would ask them to change their clothes and shower before leaving work to prevent tracking lead particles through their car and into the home. And if that isn't possible, when they get home, they should remove their clothes and shoes before entering the house, shower immediately upon entering the home, and wash their clothes separately from the rest of the family to prevent that cross-contamination. And we should cancel all families on general hygiene practices that could reduce lead exposure. Hand-to-mouth behavior is developmentally normal and appropriate in infants and toddlers. But in a home with lead painted dust, that small child could easily pick up lead particles on their hands and then immediately put their hands into their mouth. So they're basically constantly ingesting that lead dust. Older children with developmental delays that may have that kind of persistent hand-to-mouth behavior are also at risk. Those who might have pica, eating non-food items like paper, biting on paint and things like that, would also be at significantly increased risk for lead exposure. So it can be helpful to make sure that kids wash hands very frequently throughout the day, but especially before mealtime and bedtime, so that when they're sucking their thumbs or sucking their fingers while they're self-soothing at bed, or just before they use their hands to eat, we make sure that their hands are clean of any of that lead dust. We also know that soil contamination is very common around older homes and in neighborhoods with nearby high-risk industries that we talked about a moment ago. So it's important not to allow children to play in the bare soil around their homes. It can be helpful also to remove shoes at the door so that you don't track lead-contaminated soil from outside into the home. And then we also know that nutrition can affect lead absorption. Children who are iron deficient absorb lead more easily, so a diet high in iron or a multivitamin with iron can help. We know that vitamin C aids in iron absorption, so some extra citrus and veggies can help. Dietary calcium also decreases GI absorption of the lead, so low-fat dairy products should be encouraged. So far we've talked about primary prevention, really referring to interventions that we could put into place before any health effects occur by trying to eliminate that lead exposure from happening to begin with. Secondary prevention is all about mitigating risks once the exposure has already happened. So this is really trying to identify those kids that have been exposed and try to make sure that we provide them with the resources that they need to optimize their outcomes. So one measure that we do for secondary prevention is blood lead testing. And then any associated follow-up and referrals, if positive, can help with that. So we do this by capillary or venous blood tests. Each have their own pros and cons, but it's really important to note that if we do have an elevated capillary test, so you do a finger prick, it needs to be confirmed by a venous draw pretty promptly. And this is because there's a chance for a false positive with finger prick testing, and the venous test may come back normal, but we need to know that pretty quickly. It's interesting though, in my conversations with Dr. Newman, he mentioned that we shouldn't really dismiss those high finger prick cases either, because an elevated capillary test with a normal venous test might indicate that there was lead residue on the child's skin that was not yet ingested or inhaled, but should still be addressed in the environment if we find it. So why do we do blood testing? This step gives us an opportunity to identify children in which that primary prevention failed, and they were exposed to lead despite our best efforts. It gives us an opportunity to treat the affected child and address their environment to prevent further lead exposure, with the goal of reducing blood lead levels as rapidly as possible. So who are the kids that we need to test? Per Ohio law, we need to test kids under the age of 6 years if they are Medicaid eligible, live in a high-risk zip code, spend time in a home or building built before 1950, spend time in a home or building that was built before 1978 that has deteriorating paint or is being actively renovated, if they have a sibling or playmate with lead poisoning, if an adult that they have contact with has an occupational or hobby-related lead exposure, or if they live near an industry known to generate lead dust. For those children on Medicaid or living in a high-risk zip code, by law in Ohio, we must order a blood lead level at 12 months and 24 months, so at 1 year and 2 years. If we do see a child between 3 and 6 years of age who's on Medicaid or living in a high-risk zip code, but never had a lead test done before, we should order a lead level at least once. So they need at least one test if they have any risk factors. Once we've performed the lead test in our office, Ohio law mandates that the lead levels be reported to the Ohio Department of Health. Levels greater than 3.5 should generate a call from the local health department to the family, which the public health official will then administer a questionnaire to assess lead exposure risks and kind of provide some counseling. Levels greater than 5 also prompt an automatic referral to Help Me Grow for some early intervention services, which I'll speak about in a moment. And then lead levels over 10 will also result in a home inspection performed by the local health department, which hopefully then will initiate the abatement or remediation process to remove those sources of lead from the home. So we see then that the roles of clinicians and public health officials are complementary. Both should provide counseling and interventions aimed at primary prevention. A clinician is also responsible for the testing, reporting, and medical management of elevated blood lead levels. And our public health system is responsible for case investigation, tracking, and enforcement of public health interventions to prevent further exposures. Over time, the acceptable blood lead level has decreased in response to more recognition of the effects of lead toxicity. So the CDC is currently using the blood lead reference value to identify children who have a higher lead level than most children. That's the definition. In 2012, the blood lead level reference value for children was established to be 5 micrograms per deciliter, decreased from the prior level of concern of 10. In the past 10 years, blood lead levels below 5 may or may not have actually been reported to parents. But the new lower blood lead reference value of 3.5, established in 2021, means that more children will be identified as having lead exposure, which will allow parents, doctors, and public health officials to intervene a bit earlier. Early intervention with speech, physical, and occupational therapy is really critical to optimizing outcomes for these patients. So as mentioned before, referrals to Help Me Grow are automatically generated from the Ohio Department of Health when a lead level over 5 is reported. In this case, in this scenario, the family should receive 2 separate calls, one from Help Me Grow to arrange that evaluation and intake, and then one from the health department. However, we know as clinicians that many attempts to reach the family are unsuccessful, and this loop may not actually be closed. We may not know that our patients connected with the resources that they're eligible for. So it can be helpful for us to have a conversation about this process with the family ahead of time so that they're expecting those calls and can respond promptly when they receive them. Outside of the automatic referral process, primary care providers and parents of children who are concerned can also refer using the online referral form or a phone call. So the potential outcomes of an early intervention include addressing the home environment, improving diet, and encouraging activities that promote development to mitigate the effects of lead poisoning. So here's really the critical piece. Some folks may feel like lead poisoning doesn't affect them or their patient population. But current data shows that every single county in Ohio has at least one high-risk zip code, and most have many more than that. The entire state is affected by lead exposure, and we all need to take steps to mitigate those effects. So that's why the Ohio AAP has hosted lead QI collaboratives in the past, why we are distributing lead board books across the state for you to distribute to your families and help aid in that conversation, and why we're initiating a new program now. So let's talk about a case study together. We'll kind of go through a very brief scenario. Mario is a 2-year-old boy who presents today for a well child visit. 1 year ago, at his 1-year well visit, his lead level was 2.3. He lives in a rental unit that is about 100 years old. He's insured by Medicaid, and he drinks at least 40 ounces of milk per day. So does he need testing today? You can unmute and say yes or no, or you can pop it in the chat if you want. I'm guessing most people will guess that he does need it, as is the entire point of this talk. Yes, he needs it. So yes, by Ohio law, he is required to have another lead test today because he is 2 years old and on Medicaid. Even though it was normal last time, he still requires a lead level now. He also qualifies for iron deficiency screening based on his excessive milk intake. These tests would include a hemoglobin, a reticulated hemoglobin, a ferritin level, and a CRP level, just to assess for the type of anemia and any potential interventions that might need to take place based on that. Okay, so we correctly identified that he needed his labs done, and they come back with a lead level now of 17.8. His hemoglobin is 9.9 and his ferritin is 3.2. So we start him on an iron supplement and advise parents to limit his milk intake. At our follow-up visit, we learned that dad works in construction and renovation, and that mom stays home with the kids. While, we're kind of doing our medical management, meanwhile, the public health department and early intervention have called the family to offer their additional services. So the public health department completes the home inspection, which confirms chipping lead-based paint in Mario's bedroom and in other areas of the home. And swiping surfaces around the home reveals that in the laundry area, which is near the kitchen, there was lead dust found in the laundry. So further investigation revealed that the father was bringing home lead dust on his clothing from his job in construction and renovation, which had contaminated the laundry area and spilled over to the kitchen area a bit. So interventions to prevent further lead exposure in this particular case included keeping dad's work clothes isolated and washing them separately from the rest of the family's items. The family was able to get a lead abatement grant through the Ohio Department of Health, which allowed them to replace the lead-containing friction surfaces, like around the windows, where the windows are open and closed, around the door frames. So they were able to get those areas replaced, and then they were able to repaint the remaining areas with encapsulating paint. On subsequent blood tests, Mario's lead levels fell to 9 at his 6-month follow-up, and then was undetectable by the time he was 4. And then his hemoglobin normalized with our recommended dietary modifications as well, and the iron supplementation. So I hope that this case illustrates the variety of sources of lead that might pose a threat to a child in their home environment, and also demonstrates the kind of tandem roles of the clinician and public health department. Here are the Ohio Department of Health's medical management guidelines that have been updated to reflect the new reference value of 3.5. I don't know, actually, is there a way I could pull those up to show folks? Let me see. Stop sharing for a moment. Apologies, I should have had this ready. Okay. So we click on this attachment here. Okay, so Mark, can you see this?
Yes, we can see it.
Okay, perfect. So these are the medical management recommendations published by the Ohio Department of Health. At the top are really just some reminders that there is no safe level of lead in the blood, that a capillary result over 3.5 must be confirmed by a venous blood draw. The Ohio Department of Health does not accept point of care testing like lead care to confirm an elevated blood lead level. And then all blood tests must be reported to the Ohio Department of Health. And then as you scroll down here, you'll see that for each range of a blood lead result, it'll kind of give you guidance on what you need to do next. So if the level is under 3.5, you don't need to confirm that with the venous blood draw. You should still be providing anticipatory guidance, talking about developmental milestones and doing a nutritional status assessment, really focusing on iron and calcium intake. And then you should be retesting at age 2. And then there's a little review of Ohio's law and when we should be testing. As you go to higher lead levels, so let's say, for example, levels of 10 to 19, those need to be confirmed by a venous draw if it was a capillary sample within 1 month. In addition to the anticipatory guidance and other assessments that we mentioned above, we also need to provide education around the potential environmental sources of lead, conducting a history or assessment to identify what those potential sources might be in this child's environment, completing a full physical exam, actually doing some of that lab work to assess their iron status, like we did in the case that we went through just a moment ago. We should provide specific nutritional counseling and maybe even connect to WIC for those patients that may be eligible. And then referral to early intervention services through Help Me Grow for kids who have lead levels over 5. And then over here again, so for 10 to 19, if we follow that across, they will need follow-up testing in 1 to 3 months. And then if the level is decreasing, they can test every 3 to 6 months after that. Until the lead level falls below 3.5. So this is kind of a nice color-coded resource to use when you have a patient with an elevated blood lead level. And then there are, of course, some resources here below, some phone numbers that might be useful to you to provide to families or to ask questions yourself. There's a medical provider hotline as well. So a quick review of that resource here as well. So I think our next, switch back to our PowerPoint here. Yeah, so I'll stop there and I'll let Suhavi or Mark talk a little bit about our upcoming practice coaching program.
Thank you. I'll take over from here. Hello, everyone. If I haven't had the chance to talk to you yet, my name is Mark Driscoll. I am one of the program managers for the Lead Free Ohio program, along with Suhavi, who spoke earlier. So all of this information kind of boils down to what Dr. Thakur kind of hinted at before, which was our practice coaching program. So if you want to go ahead and switch the slide, you can click through all of them. So the hope of the program is to be able to send out trainers that we have trained here at the Ohio AAP to practices across the state of Ohio. The goal is to improve lead poisoning prevention, testing, and screening, and then any other follow-up or questions that may come from that. The sheet that Dr. Thakur mentioned with the medical management guidelines will be covered, and how those can kind of be integrated into your practice as well. And then really the kind of special part of it is that everything will be tailored to your specific practice. So we'll be sending the coaches to your practice for a 1-hour visit to make sure that the way that the screening, testing, and follow-up is completed fits into your office's workflow. I think we can change the slide. Oh, and then you have the support from us and our trainers. And then for participating in the program, there are some incentives. There's a $500 cash stipend for each individual site. So if you work in a system, it would be each individual brick and mortar practice. You would receive that $500 stipend. Some of you may have already received some of the lead board books or have ordered some of our board books. But you'll receive additional books for participating in the program as well, for the Thanks for Keeping Me Lead-Free board book, which is a great resource for families that talks about kind of the mitigation process and things that you can do to make sure that kids are less exposed or not exposed to lead in their home. We're also developing a rack card with resources for physicians and families, different handouts that we'll be using, and then you'll get the training content as well. Yep, and I think you can switch a slide there. Thank you. Oh, and you'll also get credit for CME and MOC Part 2. Thank you. And then what will you be responsible for as a provider for us? There is an additional webinar training after this through Zoom in February. Those are scheduled on February 8th and 16th. I think some of you that are here now have already registered for that. If not, in my follow-up email today or tomorrow, I'll be sending out information to how to actually register for the program. And this 1-hour training is included in that. That will just go a little bit deeper into the topics that Dr. Thakur covered today, and then some new information about lead and office workflow and practice workflow. Can you go back? Sorry. As far as data that you'll be responsible for, There'll just be a small pre-survey that you'll complete with me over a Teams call or a Zoom call, and then also a exit interview that'll be just a quick exit interview as well. And then I mentioned that 1 hour office visit. We'll schedule that once you're officially enrolled in the program. Then you'll want to integrate the best practices that we've identified through our training. And then I have the exit interview on that. So that's what you'll be responsible for as far as if you sign up for the program. Now I can switch. Thank you. This is the QR code to sign up. I know we'll go through it quickly. So today I'll be sending out a follow-up email for how to receive your CME or MOC Part 2 credit for today's webinar, as well as a lot of our links to some of our programming. So how to sign up for the program. I'll include the PowerPoint from today. I'll send a digital copy of the board book so that you can take a look at that. If you haven't already seen that, it's pretty cool. We have like a online flip book version that you can see. So you'll get lots of cool lead information today. So if you can't necessarily get onto this QR code right now, you'll get all of that information in my email as well. And then any questions? I think we have some time for questions for either myself or Dr. Thakur about anything that was covered today. I'll stay on here if you want to unmute and ask questions, we're here. Or you can add them into the chat too. We have one question that says, is there a convenient way to locate businesses that emit lead dust?
That's a great question. I can look into that and see if we can share back with this group that's attending. And that might be something Dr. Newman, our partner in this program, may have information for as well. So we can see if we can find that for you. But I don't know of a way to conveniently locate or identify those businesses.
Other questions about the program or lead in general? Community resources for testing environmental lead in older homes.
So community resources for testing environmental lead in older housing. So, I mean, there are test kits that you can purchase if you wanted to like test surfaces around your home, and then they're not necessarily, you would still need to do a home inspection if you do find resources or sources of lead contamination in your home. You would still need to have a home inspection done by the public health department in order to access some of the resources that they have. You can also pick up at Home Depot or Lowe's water testing kits to test your water quality and see if there's lead contamination there. So those are some commonly accessible resources. Aside from that, most environmental testing will be done through your public health department. So calling them if you have questions, or even some city health departments will provide that as well. And then just some other things to note. So there are services that we may not commonly think of that your health department can provide. For example, you can borrow a HEPA vacuum from most county public health departments or city public health departments to do some kind of deeper cleaning of your carpets and things like that, and try to eliminate a lot of that lead dust that might be lurking in areas. So rental of those, most counties will offer it for free, but that is something that families can take advantage of as well.
Well, a question about public health departments doing inspection. Will they inspect if a lead level is 3.5 to 5, or does it have to be a Venus level of 10 to be able to get that service from Ohio?
Yes, so Ohio Department of Health's current guidelines state Venus samples over 10 will generate a home inspection. There may be opportunities. So like, let's say that there's a certain county where they might offer that. That would be very individual. That's not the state standard. So I would you might have to ask locally what is available and what their specific cutoffs are for offering a home inspection. But the state standard is venous samples over 10. Yes. I think that's part of why there is a lot of advocacy right now happening to try to provide some of those resources for lead levels 3.5 to 10 or 3.5 to 5 even. Really trying to think about what resources we can offer when we're identifying a patient as having lead poisoning, but then can't do much to address their environment. So there's a lot of advocacy happening around that.
We also had the question if you had any advice on what to do if families refuse to have a lead level checked.
So this is where some of the talking points that we covered in here can help. We know that every zip code, or sorry, not every zip code, every county has at least one zip code that is affected. That means that this is throughout the state. We know that it's different types of housing, so both urban and rural. We know that a lot of this just has to do with the age of the home and the condition of the neighborhood, but there's no stigma attached to it. You could have older, wealthy neighborhoods that have lead poisoning. So I think sometimes that refusal comes from the stigma associated with it. Sometimes that refusal comes from fear that they're going to have to leave their home and where do they go and that type of thing. So ensuring that you have additional wraparound resources to offer patients, whether that's a social work referral, a community health worker, phone numbers to your local building and housing department, those types of things might be helpful as well. Legal Aid Society is very helpful, or other legal partners, because if you do have someone in a rental unit who, their landlord may not be performing the remediation or abatement work as suggested, or may not even agree to the home inspection or pursue the home inspection. In those cases too, renters have rights. So understanding what those renters' rights are versus the landlord's rights can be very helpful in managing those patients. If the lead level comes back over 3.5, does the lab automatically? Yes. So lead levels at all of our major healthcare organizations, any lab that performs lead testing in the state is required to automatically send those results to the Ohio Department of Health. Yes.
Other questions?
Yes, absolutely. Living near an interstate is also a risk. That's a great point.
In our region, the highest soil lead levels are actually along a really beautiful park called Mount Airy Forest along I-74. Not a lot of housing there, but all the stream beds and lead levels that come through there were contaminated just because of leaded gas in the past. So
yeah, it's sad. It's
yeah.
It's very interesting, but it's sad. So are there ways to test soil levels? Yes, when they do home inspections, they will collect soil samples and they will test those for lead, but that's not something that most families will have access to test on their own. And the way to prevent exposure through soil is to cover it. So either planting grass or covering with mulch or covering with some other type of material so that it's not bare soil.
Hello. When do you recommend water filters?
Yeah, so if there's concern that they might have lead pipes in the home, you definitely can advise them to use water filters. In addition, making sure that you run the water on cold for a couple minutes before you collect it for ingesting, because any water that's been sitting in the pipe may have leached some lead from the pipe itself. And so then you want to make sure that you clear whatever water was sitting in there. And then cold water, of course, will leach less than hot water. So you want to run it on cold for a couple minutes, collect it cold, and then use it for boiling your pasta or mixing your formula or whatever that might be. But filters are absolutely part of the preventive strategy there. Any home where they're concerned about lead pipes, you can ask them to use a filter.
Yeah, I'm concerned about this because they had a whole family with, it turned out lead in the water from pipes coming up to the house.
Mhm.
And all the children were affected, but, so if you get a child with a 3.5, let's say, or above, do you usually ask them, just go ahead and test the water?
You can, absolutely. So I typically will talk through all of, since I don't know specifically what the lead sources might be, I typically will talk through a lot of these different preventive strategies with them around making sure that we keep kids away from areas where there might be chipping paint, painting over areas that, you can visibly see that there's chipping or deteriorating paint. How to either use a water filter or, the recommendations around running on cold for a couple minutes. I typically will go through a lot of those with them. If there's a concern about having lead pipes, so if it is an older home where that is still likely, then yes, absolutely, they can and should test their water. A lot of folks now do still live in newer housing, but in historically lead contaminated areas. And so the lead pipes may not be there, but then the lead paint is still there. So just kind of trying to identify which risk is most likely, but asking them to test their water or use a lead filter is a pretty easy step to take. So absolutely.
Right, thank you.
That was a long-winded answer. Sorry. I'm like thinking things through as I'm talking about it.
Yeah, it's okay. I just want to say they had kind of a journey finding that out because they did lead abatement, everything was done, they had the indoor pipes changed, and then they had it, and all the kids came down on lead, and then they had a baby, and that baby had lead. So then they checked the pipes coming up to the house, and those pipes had lead. It's unfortunate that it took so long to find out, But anyway, thank you.
All right. Any other questions, or I'll go ahead and close this out for today. Yeah, there's a good resource from Dr. Lazaran about checking your lead pipes in the home too.
Wonderful.
Great. Well, we want to thank everybody for attending today, and hopefully we see some sign up into our lead practice coaching program after today. Like I said, I'll send a follow-up email with information on that. We also want to make sure that we thank Dr. Thakur today for the wealth of information and staying with us to answer questions. If you have any additional questions, feel free to reach out to me by my email or phone number there. And then we look forward to seeing you in the future. Thanks, everyone.